The fact that we built this facility, most of healthcare would have put the odds against it. The seamless exchange of information to improve healthcare for all is really our vision statement. We are fighting to build the highway of data liquidity in healthcare, where interoperability is absolutely a right and a utility.
I was taken initially by Ed's passionate argument for the power of interoperability, and I knew right then that we needed to be involved in the project.
The idea is that vendors will build into their devices or their systems the platform that we develop that will enable connectivity, two-way plug-and-play connectivity between devices and other devices and software systems and that sort of thing.
It was apparent that there was going to be more of an office component to the project, as well as the potential of a healthcare component in terms of simulation labs, be that ORs, ERs, and so forth. So it was apparent then that GS&P brought strength in both of those areas.
Our scope entailed the interior design services. It was a complete tenant fit out of 3 independent suites, 16,000 square feet, kind of chopped up into 3 areas. The first was this meeting space, and it was really meant as a place to convene. Part of the program was the core engineering space. And then the third space, which is tangent to that, is their partner space. So it's a space that is almost like a co-working space for other engineers and other healthcare companies. The engineering space includes workspace, a few offices, a lot of collaborative areas. This transformational learning center, which is really a place where clinicians can come and throw out the big ideas, like what do they need, how do they need these things to work? And that is directly adjacent to the testing and certification lab. So it's a testing lab now, and then once they get all this technology in sync, then it will become a certification lab. A really wide range of work settings provides the greatest flexibility, and when you don't know what you need as a startup, that's the right thing, is to be flexible, and it also suits different personalities.
We're starting to really grow our ranks. We're hiring technical folks to come on board. It's an easy place because of the openness and because of some of those interesting elements that Gresham incorporated into the space. It's an easy place to I think, be creative. That's what this is all about. I mean, we've got some really creative people here that are doing this really difficult work. It's been an overwhelmingly positive response from everyone that's come here to talk to us about interoperability and data liquidity and the work that we do, to take them through the space and to show them the technology that we've incorporated in, to show them the workstations, the meeting rooms, the space, and I just think it's fantastic to come to work here every day. It's a beautiful, functional space. It talks about where we came from, and it talks about where we're going.
My members are the CEOs of the most prestigious hospitals. We wanted to convey our members' personality and DNA in this space. The architects have done just a phenomenal job making the interior space match, the mission.
They're a nonprofit, so it can't be overly showy, but it's technology centered, so that should be evident too. This whole idea of following the flow of data is probably the most tangible concept that can be seen throughout the space. But also, even though it's a technology company, being able to have something that feels local and natural and not cold, something that's welcoming. I think the most compelling part of working with the Center for Medical Interoperability is just the opportunity to see things from the beginning. The development could be revolutionary, and that's a magical thing to be part of. One of the most rewarding parts of this project is being able to support the center literally providing a place that supports their work efforts to be able to do what they do to ultimately save lives.